Hi friends, I'm Dr. Monsi. You are watching my YouTube channel. Today I'll talk about dengue fever, its symptoms, and to some extent treatment. I have divided the video, the slides in two parts. First part I'll discuss about the common symptoms. Second part I'll discuss about the warning signs. So what are the common symptoms that can occur along with fever? Eye pain, headache, muscle pain, rash, bone pain, nausea, vomiting, and joint pains. These are the common symptoms along with fever. Now, how to manage when you are having this kind of symptoms along with fever? You can think about it may be a dengue. So you have to take bed rest and let your sick child or family member rest as much as possible. And you have to control the high fever by taking or giving the patient paracetamol, only paracetamol. There is no other drugs you can use for fever control like aspirin, ibuprofen. One and only drug is paracetamol or acetaminophen. And you have to sponge the patient's skin with cool water if fever remains high. Now, what are these things very important? Dehydration. When patient is very dehydrated, it is emergency condition in case of dengue. The cause of the dehydration is fever, vomiting itself. And how you know that the patient is dehydrating? You have to watch some signs like decrease in urination, few or no tears when a child cries, dry mouth, tongue or lips, sunken eye, restlessness, overly agitated and or confused, rapid heartbeat, there is more than 100 beats per minute, cold or clammy fingers and toes, and sunken soft spot in infant's head. There is soft spots present in infant's middle of the head that is called fontanelle. In case of dehydration, that got sunken. So if these signs are appearing in your child, you have to go to hospital or emergency room as early as possible. Now, what are the other warning signs besides dehydrations? And you will surprised to know that although the fever is going away, this phase after going away of fever, the phase of dengue can be dangerous for some patients. You have to watch the warning signs as temperature declines 3 to 7 days after symptoms begin. And if these any of these signs are appearing, that means it's severe dengue and you have to go immediately to the clinic. Now, what are the warning signs? Severe abdominal pain or persistent vomiting, red spots or patches on the skin, bleeding from nose or gums, vomiting blood or blood in stools, drowsiness or irritability, pale, cold, clammy skin, and difficulty in breathing. So, if these signs or symptoms appearing in a patient, that means it's emergency and you have to go emergency clinic or hospital immediately. Last slide I'll like discuss about the prevention part, and you all know how to prevent dengue. It's caused by mosquito bite, so you have to use bed net, you have to use mosquito repellent, window screen, and know the mosquitoes that bite the affected family member can go to bite or other family members too. It infects. Infection will go like this. So allow the sick child or family members to rest and sleep under a bed net or use insect repellent while fever is. So you have to maintain these things. These are important. Thank you very much for patient hearing.